Hey guys, this is Professor Un, and in this video, I'm going to show you how optimal label placement for your medication syringes can make a big difference in reducing risk of medication error, as well as improving OR efficiency. Now, if you're wondering whether you should label before or after drawing up your syringe, I want you to imagine that in the middle of this process, you hear an alarm go off, and you might need to stop. If your first step is labeling, all you have is an empty syringe, which is benign. On the other hand, if you drew the syringe first but got interrupted after, there is a moment where you have an unlabeled syringe with unidentifiable liquid inside, and now a medication error becomes a possibility. Seeing an unlabeled syringe with clear liquid inside should make you sick to your stomach. Avoid this as much as possible, and if you ever find one in your OR, dispose of it. Let's take a moment to look at these pre-made syringes from the pharmacy. Notice how every label is placed in the same way and contains the name of the drug, the concentration per ml, and either a date that it was prepared or an expiration date. This placement also makes it possible to see both the volume of the drug and the name of the drug at the same time, even when you're in the middle of administering it. All of the labels that we prepare for our syringes must allow for the same simultaneous recognition of the drug name and volume, and we should also make sure we include the concentration and a date and time that we prepared it. Here's what my tabletop typically looks like during the maintenance phase of a case. Notice how my labels all have uniform orientation. This consistency helps with quick identification of syringes and reduces cognitive load on the brain during rapid drug selection. I personally like having my pressors on one side and analgesics and sedatives on the other. Find a method of organization that works for you that still allows for easy identification of the syringe and be consistent with it. The brain recognizes consistent spatial layouts faster than variable ones. Here is how your syringe should look if it's labeled properly. Notice the labels on the left side of the numbers, and when I lay it on my table, it matches the orientation of those pre-made syringes, and there's minimal movement required to bring the syringe to the patient. I have seen other providers place their labels on the right side of the numbers like this. It's not necessarily bad, but if you place it this way, you have to make it flip towards the patient every time, which is a little less efficient and there's less spatial consistency. Now here's the absolute worst way to place a label. I don't know why anyone would place it on the opposite side of the numbers, because in this situation, you have to decide whether you want to see the drug or the volume. It's impossible to see both at the same time. I don't recommend doing it this way. So to recap, make sure you always label your syringe before you draw up your drug. Place your labels on the left side of the numbers and make sure when the label is being read left to right, it's going from the tip of the syringe to the plunger of the syringe. This will match all your pre-made syringes. If your hospital uses these sticker type of labels, make sure you add a second one that goes around the circumference of the syringe as well. And always make sure you date, time, and sign those labels after you draw up your medications. Now that you know how to properly place your labels, you're ready to start drawing up the drugs, which I'll cover in the next video.